In today's video, we'll be discussing about microscopic cultures and sensitivity, that is MCS. What you need to know about MCS. That is what today's lecture is all about. So, hello, you're welcome back to my channel. And before we proceed, if you are new to this channel, please, or this is the first time of you watching my video, subscribe to my channels and turn on the notifications so that you get notified anytime we upload a video. So having said that, let's get started. What is microscopic cultures and sensitivity? A microscopic cultures and sensitivity, often abbreviated as MCS, is a medical laboratory test done to investigate the cause of infections, most especially bacterial infections. So most of the people who come for this test are people who suspect to have sexual contact with somebody that have sexually transmitted infections, or sometimes due to some medical condition like sore on any part of the body or some reactions in any part of the body can trigger a medical doctor to request for MCS. Now, these are the details in the test. When they conducted the test, but what they use in conducting the test, depends on what they are actually investigating for. If they are investigating for sexually transmitted infections in a woman, then they might decide to collect high vaginal swab and urine. Sometimes depends on the medical doctor request. They may decide to collect sample from cervix, which is cervix. But if it is a man, they can collect sample from the urethra and also urine follow, or they might just decide to collect only urine. That is for sexually transmitted infections investigation. But if, for example, they want to, if somebody have big sore on his leg or on her leg and the sore refused to go, they want to investigate what is the result of this sore that refused to heal despite all different medications. Then they may collect sample from that sore. Then maybe get swab stick and get some little sample from the sore. What if somebody is having pores on his body or in his private part? Sometimes they might decide to know what is the cause of that pores. Then the scientists might decide to collect pores from there. Or somebody has a swollen part of his body that has these pores in it. They might try to pierce it and get some sample from the pores and do the cultures and sensitivity. Now, after that, the culture takes 3 days before the result will come outside. There are some that take more than 3 days, depending on the investigation, but most of the investigation take 3 days. The first 24 hours is to inoculate the media, which they will be examining or observing till the next 24 hours. Again, after the first 24 hours, they will insert sensitivity, that is to check which of these drugs that will work for it. That's one of the best aspects of MCS. When they insert the sensitivity comprise many drugs. That it comprises a lot of drugs, antibiotics. This sensitivity will, shows these drugs work for it, these drugs work for it. So after that, the laboratory scientists will bring out the result, will compile the result and bring it. This is how the result goes. For many different laboratories has their own way of writing their report. So don't expect the same pattern that you see from a laboratory A to be the same patterns you see in the laboratory B. However, their writing must be the same. That's if the writing for However, the writings must be the same. So no matter how the patterns they write it, the report must indicate what they see, which microorganism they see, and which drugs will work for it, and which of these drugs will not work for it. So often this is how the result is being written. After 48 hours incubations, so microorganism isolated, that's the name. Let me say, for example, now 48 hours incubation, Candida albicans isolated or Staphylococcus aureus isolated 2+, they can give indication plus. That plus is just to indicate how sensitive the microorganism is. Now, after that, giving out the result, let me say, for example, now after 48-hour incubations, Staphylococcus aureus 2+ isolated, or growth of Staphylococcus aureus isolated after 48 hours incubation, or they can say growth of Staphylococcus 2+ isolated 48 hours after incubations. So this is just to give the details or tell the medical doctor that this is what they see after 48 hours incubation. Now, when you go down to it, you're going to see down the result, they are going to indicate, you see, sensitivity and resistivity. Sensitivity, it simply means that this is the drugs that work for it, while the resistivity simply means that this drug does not work for it. In the sensitivity, you're going to see the list of the drugs which work for it, and this list sometimes they will indicate the sensitivities of it with plus. Like those ones that are highly sensitive, you see 3+. Those ones that normal sensitive, you see 2+, and less sensitive, you see 1+. Why those ones that are not sensitive, some scientists might leave it neutral, some scientists might indicate minus, just for you to understand what is there. However, the sensitivity, maybe for example, now you see like 10 to 15 drugs which are sensitive to it. That does not indicate that you are going to take all those medicines or drugs. No, you're going to choose one among of those drugs to take. So however, if the result come outside, the best, I will advise you that you see your medical doctor so that he can go through the result, also ask you some few questions to know which of these drugs that will suit your system, because sometimes you might have one or issues that your system might not be compatible to one of these drugs. So he will ask you some few questions, then will select the best drugs among of this, the least sensitivity given to you there. So that is the best part of doing microscopic culture and sensitivity. And in our final recap, the test simply to investigate the cause of infection. The test come with the drugs that work for it and with drugs that will not work for it. So after the test, you are not to, if you choose to go to chemist, some of the pharmacists have their own doctor waiting for you to, they will just see the result. They know already what is in the result, then they will give you the medications available for it. But the best of it, you could see your medical doctors. He or she will ask you some few questions, then get the details regarding to your body system and give you the best. So we have come to the end of this video. Thank you for watching. But before we go, please don't forget to subscribe to this channel, and see you in my next video. Bye.